start the next 24 hours. In this 24 hours, we don't have to uncover every symptom. I'm still going to be doing every patient, so still one doctor, all patients. We have the luxury of this daily news, meaning we've got 185 patients. I reckon we can do this, except for our wards are rammed, right? Our wards are pretty rammed, so we're starting very busy. We've got 8 hours to go before people leave the wards. Look at infectious diseases. It's pretty desperate. But we haven't touched our ICU overflow yet, which is over here. Not touched that. How many are actually in ICU at the moment? So we've actually got 2 spare beds still on here. Still got 2 spare beds on here. And then we have all of these, should the muck hit the fan. And what we're going to do, and labs are obviously still rammed, so it's not like it's all fresh. We've still got all the stuff from the previous day, right? So the labs are still backed up. Yeah, I wish we could see how many tests were outstanding on the labs, but we can't. So yeah, still every patient, but we're not going to get every single symptom uncovered. We're not going to do every single test that needs to be done. We are going to get to the root of the problem as quickly as possible. We're going to treat it. We're going to kick them out the door. We're going to also try and not kill anybody. So I need to be aware of, and given that I'm on specialist mode, that means that if there is any symptom that could kill them, that's hidden, I won't know about it, in terms of it doesn't pulsate, it doesn't give me a clue like that. All we've got is the crossed arms, and there's a lot of situations where they don't cross their arms. So let's bear that in mind, shall we? So here we are. We've done really well though. I think we did better than I imagined here, right? I feel like we did better than I thought we would. Let's do it. Let's do this. Let's do this. And of course, we're still dealing with all the patients that are already here. But you see, Patricia, we haven't uncovered all of her symptoms, but we have done the tests. I'm not going to worry about it now. So we are going to, I think with her, we've dealt with anything that's particularly bad. We're going to take her off the code blue. She is actually just done, isn't she? She's all good. And have you noticed it has started to calm down a little bit, hasn't it? We got a little bit more time between each patient. It also feels weird me not doing my rounds, so I'm not doing sort of my rhythm on what I do at different hours of the day in the game when I'm just dealing with certain patients. That also kind of feels a bit weird. He's fine, don't need to worry about him. Yeah, it just feels a little bit weird. This constantly flashing does get annoying though. Carol. What's going on, Carol? Nothing. Nothing is going on with Carol. Interesting. Maybe something should be going on with Carol. Let's find out, shall we? She's on. Right, well, it's just because I've stuck her there. So what's easiest to deal with? So it looks like infectious diseases. We've got anything under? Wow, there's a lot of infectious diseases. Oh my goodness. Okay. I mean, it could be anything. So I'm inclined to send her for like an angio. What's this one? I'm going to send her for an angio. Am I? I'd like to. I can't. Wrong department. Move her. Send her for an angio. Thank you. Casey. What's up? Would you like a physical? And we should also take your temperature. Yeah. We'll do that. That's good. What is this? That's fine. There we go. Also, would you like something to stop the vomiting and take something for the headache? Cool. Paul Hall. because I'm also now probably not going to give them all the medicines either. Paul is fine. We were waiting for the the RT-PCR. That's what we're waiting for. Mark Martinez, again, we're looking pretty good. I mean, we'll do this, but didn't need to. His comfort is good. His comfort's good, right? That sounded like a double ping. Let's... Patient's leaving. She's been waiting too long. We've sent her to observation. She was supposed to be in observation. Although she's been, it's blue, it's done. She went to observation, she's left observation. No! Oh God, there goes, there's one already. Right, okay, let's try not to worry about it. She'll be back tomorrow. I don't know if we're going to be doing tomorrow. Okay, let's see. This is, how have we still not got this? Oh no, there are more tests that we can do here. Let's do the periphery and all that. Oh, we can't do that one. Oh, that's not the one I meant. Where's the other? There's another one here. Did I do it? Oh no, I've done it. Have I done it? I feel like there's another one. What's the one that's missing? Is there not one that's missing? I guess not. Maybe I'm losing my mind. Am I losing my mind? I thought there was one more. Guess not. Guess not. And we can see she's got some discomfort. Right? Which these two, and that would also just give her the lot, actually, in this particular instance. Yeah, don't worry about that. There we go. It's quicker. We're all about quickness right now. Okay, Brooke. Fine. Just waiting for that to come back. Nice. Michael has a tachycardia. Not good. Is he actually? He is on the blue. Good. David, take him off blue. You're all good. You're all good. Karen. Oh, I don't have to do this anymore. I could just send her home. I could just send her home. We don't have to do this anymore. Home. Excellent. She's had her anti-venom. We're all good. Right? We are all good. So do a physical and an evaluation. Here. Thank you. Thank you. Thomas Young doesn't need our attention at all. That was a lie. Robert Adams, waiting for the results of the blood test. Take him off blue alert. Yeah. Okay. What's why can't it have been Karen Miller again? What am I missing? Karen Miller. Here I went for stool. There would have been a reason for that, but we've not really done much of anything else. What could the reason possibly be? Stool. Surely serologic is the logical choice here. Let's do the serologic. Can we also do a physical? His comfort is bad. Vomiting, fever, pain, fever. Okay. Good. Long wait for examination. Get rid of it. Let's hope he's not infectious. He could be infectious. He is infectious. He's got that. He's got that. This is what he has. Okay. See how I start playing differently? Okay. stop the vomiting. It's disgusting. Right, okay, here we go. Right. Let's see here. I would like to... She does have discomfort. We're going to do the protective thingamajiggy and give her some painkillers. Tell her to get some rest. See what that does. Okay, Lisa Lee. We know exactly what it is. Give her these. And those. Okay, good. So that will deal with the fever. I'm looking at things. What I'm doing here, I'm giving her obviously the treatment that she needs for what she's got, but I can see here that we've lost a star on comfort, and I want her to feel good before she leaves, but I don't want to overdrug her. I want my doctors and nurses to spend as little time on every patient as humanly possible right now. Rest is a little unnecessary, but I just like to do rest. That's a me thing. Don't need to do that. But I can see here the fever, and I know that the fever, along with the muscle pain, the fever will cause discomfort, but we've only got 1 star of discomfort, so I'm just going to see how much that does and if she needs more. That's why. So with Linda Lopez, we can see here that she can go home. We've told her to get some rest, and her comfort levels are fine. Right, so I'm not going to give her these things. We're just going to send her straight out the door, which makes this GP doctor instantly free. All right, saves time than trying to mess around with the printer and prescriptions and junk. It is less money for us, because if we did give those prescriptions, of course, they would pop over to the pharmacy and spend lots of money. But right now, I want them out the door. I don't give a damn. Okay, we've got enough money. But if you were after money, write the prescriptions. Mind you, hospitalisation is the best way. So when I was building this hospital and I needed lots of hard cash fast, what I would do is I would get through the entire day. And then if I had room left, hospital beds left at the end of the day, I would just start hospitalising people that just didn't need it so that I could get the money. Little money tip for you there. So this gentleman I know doesn't have this, so I'm not going to send him for an angio. He's absolutely fine. His comfort is good. He's going home. Get out, Paul. Get out. Casey. Sometimes people need to be told. Is that the rest thing? Yeah. Get told to get some rest. Yeah. Otherwise they soldier on and on and on. They do, and it just gets worse and worse and worse. That's it. Exactly. Yeah. I think it's just good advice. Indeed. So now, what is going on with you, Casey? God, we've done all sorts of looking in his eyeball and we've discovered nothing. Interesting. So maybe we should do a microbial on this, because we've done that, right? We didn't do the angio. Not done an angio. We've done that. Microbial again. Microbial. We're going to do the angio first, because I'd really like to not do a test. So we're going to go for the angio. It seems unlikely that this will tell us anything, but we also might get lucky. Who knows? Let's try. Rachel Martin is back. I'm going to send you to general surgery. Yep, that's what I'm going to do. Is there anything else that we could... So you've had the CTs. We've had the CTs, and it told us nothing. We're going to have to do tests. We've got a blood test underway. You had the bar and swallow, didn't you? No, you didn't. Do the bar and swallow. And now that she's going to general surgery, we can do an interview. Let's do that. In fact, just do that. Get her to general surgery and do an interview. Yes. Okay, William? Waiting for the results on the PCR. I wish I could cancel it now, but I can't. Now we don't need it. Fine. Fine. Always prescribe rest to people in the ICU. Yes, actually, yeah, because that's the one place where I think if you don't do it, they could just keep crashing, right? I've noticed that pattern. That's a thing, isn't it? And it's totally a thing. Oh, he has malaria. It's not nice, is it? His comfort's okay though, so we'll just get him that sorted. Get him off of code blue. Okay. Oh no, I have got. That's the guy we just. Oh, he's had it. Oh wow, that's happened much quicker than I'm used to. It's saying that he's had the meds prescribed to him, the one we've just done. Wow, that's weird. Okay. Conjunctivitis. So that's what he has. Now we do have a little bit of discomfort. And while the antibiotic ointment doesn't cause discomfort, it also won't improve, I don't think, this, because it's the eye pain that's causing it. So to get that comfort up, I'm going to have to give him the painkillers along with his antibiotic ointment. It has to happen if I want to get that to 5 stars, which I do. Okay, David Wilson. Let's see. Anticoagulants. When you get back to thingy, I'd like you to go to thingy. Okay, good. When you get back to trauma, I'd like you to go to cardiology. That's it. Patrons, I hope that you're all in the Discord, because of course it's the big summer Steam giveaway. If you are a patron, you can enter it in our super secret hidden patron giveaway channel. We're giving away £100 sterling of Steam credit. I'm giving 50 away to the first draw and 25 to second and third place. We've actually got quite a few patrons in, which is great. You do need to be in the Discord, so if you're a patron, because I've got a lot more patrons than I do patrons inside the Discord. You do need to be in the Discord. I'm hoping to do those big giveaways every season for patrons, but then every week we do £10 Steam giveaway just to anybody that's in the Discord. So you know, if you want Steam credit, a chance to win it, you know what to do. So thermal leg burn. Also, there's generally links to the Discord in the description of videos, and even on the YouTube channel in the top corner as well, in the banner. So we get a lot of discomfort with traumatology, obviously. It's burn. So we are going to do a few bits and bobs there and see how Margaret gets on with that. She's with Pearl Junk. Mark, go away. Okay, good. Go away. Christopher. Ooh. Christopher, 5-star comfort. Turn off blue alert. Get out. Feels good. Feels good. Byron Bog, he was with it. Sarah. Foot contusion, numbing ointment. We've got a big old cupboard of that. David Brown. Good. You're all good. It's nothing to be done there. Nothing to be done there. What have we got here? Brooke. Oh, she's got the hypothermias. Let's get her into trauma right now. I guess it's going to have to be high dependency unit. Oh, it won't let me until she's actually going to the ward. Oh, jeez. Not good. Not good. Right, so controlled patient was treated with her numbing ointment. She can now go home. Get out of here. Oh, God, that's so nice. Okay, Mary Cole. Good. I think you do actually have to be hospitalised for this. Don't you? I think so. And I've only got isolation available. Take her off of code blue. John has had a stool analysis. Okay. They've collected his stools, everybody. Great. Please we know that. Right, what's going on here? Byron has a lady. It could be all kinds. Or one orthopedy thing. Interesting. Let's start with the physical. Let's take her temperature. Let's do a CRP because I'm pretty sure we can do that here, can't we? Right here. And sometimes it gives the game away a little bit on what they have. Sometimes, not often. I can never tell if that's neck palpitations or the one where you actually look down. Do those things. Thank you. Byron. Paul. We need to look at your eye. Oh no, it is all microbial. There is no escaping this one. There is no escaping it. We do have some discomfort, so we'll do a physical. Although we've got one unknown discomfort. We'll do the recommendations because it will get rid of this discomfort. It will neutralise it. And we're going to have to do... we have to do a lab one. We've got no choice in the matter. Now, we did do the chest x-ray. Damn it. We've wasted our time on that one. We can do the numbing ointment. But we can see we have 4.5 stars. So it probably needs to give him some painkillers as well. Because that's just going to be the pain. Yeah. Numbing ointment's not going to help with that. No, it actually gives them some discomfort. Numbing ointment. So we'll do that. Fine, good. Don't care, Dana. I don't care. Susan. Susan, how are you? Good. You look fine. Go home. Get out. Get out. Anybody with crossed arms? No. Okay. Procedures have finished over here. We've got a little bit of discomfort. Let's give them some painkillers. And painkillers, you'll note at the bottom, it says discomfort, it says positive. So we get a little boost. It doesn't matter what the discomfort is, it's going to make her feel better. Right? Oh yeah. But she's in pain. I mean, the discomfort's coming from the pain, so it just makes sense, doesn't it? Susan Miller. Hello. Hello. How are you doing? You're on general surgery. That doesn't really mean anything these days, though, because I probably put you there. Let's do a physical. God, it could be anything. Let's take your temperature. Let's do the auditory. Let's do abdominal palpitations. The CRP. Blood pressure. I'm going to do a lot. But there's a lot here. Chest. What else can we spy, peeps? What else can we peep? I think it's a pretty good start. I was wondering if we need to do like the thorax percussion thing, but I'm not really seeing that here. Okay. Good. Right? Would you agree? Good. Linda. Hello, Linda. You had your rice. That's good. Is that like an opera? No. Okay, cool. For like spraying and stuff. Okay. Let's do the physical. I just feel like it's weird. When you don't do an interview or a physical, I think it's weird. So it's not necessary to do that. She doesn't even have any discomfort. But for me, it's one of those personal preference things again. It just feels weird not doing it. So Jane Lee is about to leave the clinic. So I'm going to put her into observation. And when she gets there, I'd like to do a physical. I'd like to take her temperature because we can see a fever there. She's got painful lymph nodes. So we are going to do neck palpitations and we're going to do oral cavity inspection. That's what we're going to do. People are arriving. People are arriving. She is a code blue right there. Her arms are crossed. Let's see here. Frank. So they might start going on to the right departments again. That might actually start happening. Good. So he could have a sprain. This is one of those situations where I'm going to do a differential. And my GPs can do differentials. So we're going to do that. I'm going to do the differential and decide whether we're dealing with a sprain or a fracture. Yeah. Casey. Hello, Casey. You have this. I think you need to be hospitalised for this. Tell me. You don't! That's good. Did office, okay. He doesn't, and he has no discomfort. Freaking sending him home. Okay, Frank has a sprain. Beautiful. So, for that, NSAIDs, okay, that's fine. Then he can go home. He can go home. Excellent. Treated. Another one out the door. Oh, it's so much better when you don't have to do all the useless bleeding exams. Right, okay. She needs surgery. She's going to need to be hospitalised for that. She is hospitalised. Right, she needs hip replacement surgery. Let's get that done. How is surgery? Should we just have a quick look? I don't think surgery's too bad. No, there's no surgeries happening at the moment. Surgery's fine. Surgery's totally fine. Okay. Now he was a code blue. He was totally a code blue. He's probably okay now. We did the ECG, it was negative, yeah, so he probably doesn't need to be this anymore. But we can see here we've got a lot of discomfort occurring. Fever, muscle and joint pain, breathing problems, abnormal pain, and then the IV antibiotics, abdominal pain, and then the having an IV causes pain. So in this particular situation, I am going to, because it's really bad here, that's for the breathing problems, this is for the fever, that's for the pain. I'd like to tell him to get some rest. I think he bleeding needs it, and we'll see how he gets on with that. But we should see those stars come back again. Can we get it to 5? I don't know, because all these tests cause discomfort, you know. That's another reason why you don't want to do all the freaking tests. Let's do a physical. Let's take their temperature and let's do a differential. See if we can avoid giving them an x-ray. That'd be nice. Okay, David, IV for you. Okay, good. Tressel, I agree with you, Blarla. The doctor should at least have a look at you. Yeah, it's a bit weird if they just said, "Now, mate, you're fine, go home." I know, right? Yeah. that's how I feel. It's just weird, isn't it? Okay, Brooke. We'll wait for those results. Oh, hang on. Causes discomfort, so I'd rather not do that because her discomfort is already quite high, and I've got nothing to give her that can reduce her discomfort because she's had this biopsy test would have caused discomfort. She's had the serologic as well. She's had an IV. This causes discomfort. She's had the NSAIDs. She's been prescribed rest. I don't think I can make her feel any better, but what I can do is not make her feel worse. So I'm not going to do that. She doesn't need it. Okay. Karen Hill. Go home. Okay. David has the bacteria thing, but he's had everything that he needs to treat it. It'll start to fade away. It'll start to go back. Because we've got the IV antibiotics in. Okay. Another David, you're fine as well. A friend of mine went to her GP recently because she thought she had scabies. There was a reason to believe she did. She didn't even get up from her chair to look, but said, "It's just in your head." Yeah, I mean, at least have a look. I mean, I know it seems unlikely scabies, right? But at least have a look, right? It could be something else. I mean, the thing is, right, and this is from the GP's perspective, and I get this, right, and this is a trap I would imagine a lot of GPs fall into, because they will face a lot of people coming in all the time with nothing really wrong with them. They will have that a lot, right? They're already under a lot of stress, and when people then do need appointments, trying to get in is very, very difficult. So it's difficult. It's a really difficult situation because they need to get through people quickly, and a lot of the people they see are making stuff up, hypochondriacs and things. But what happens as a result is that sometimes their flippant attitude means stuff falls through the net, right? The appointment's been made. Your friend made it there. She's sitting right in front of the doctor. Do a physical, at least. Ask her how she feels. Just something. Right. So I understand the GP's frustration, but at the same time, come on. Do you all think I'm full of nonsense? Or do you all hate me now? Right, okay. We don't have to do all of these tests. We don't have to do all of these tests. We don't have to do any of these tests. Long wait for examination, doesn't matter. Cancel them. You don't need any of them. Brilliant. Peter Hill. I am so happy. I'm happy. So happy. Yeah, Google search for symptoms is a doctor's vote. Yeah. My mum does that. Again, see here, we don't really need to do everything. We don't need to do everything. No, we don't. We don't need to do anything here, but I'm going to do the physical because it's weird if I don't. And they do have arthritis. So I'm going to do it. I'm starting to like Blarla. Ruby all this time, she's hated me. She's just here because she actually hates me. Is that true? I thought you were my biggest fan. What's happening? No, I've just thrown everything into doubt. I don't know what's happening anymore. I don't know up from down, left from right. What is... Oh no, look. We've got some problems here for Margaret. Because there's a lot of discomfort. We kind of done the thing, but there's a lot of discomfort. So what we're going to do is try and reduce that. So the discomfort is coming from some things I can't do anything about, like burn management and emergency care cause discomfort. She's had painkillers, which helps take the edge off a bit. We could give her steroid cream. Right, now it doesn't have a positive effect, steroid cream, on her comfort. But what it will do is cancel out this, right? It'll neutralise that one, which is only like a little bit of her discomfort. Most of her discomfort has come from the treatment that we've given her. So we are sending her home probably with 4 stars. We might be able to get that half back, I don't know. That's a shame. We got the 4. I can't get any better than that with Margaret. Damn. Feels bad. So what's going on here? Now, we had renal vascular surgery. We've had the PS blood control, came back negative. We've done 2 physicals, came back negative. So I think the surgery went well. So I don't care, Casey. Right? About your urine test or nothing. Don't care. Paul Martin. I mean, dark urine does generally mean you need to drink some more, and rehydration is a thing here, but I don't want my staff spending time on you, and you don't need it, so, but have a drink, Christ. Drink some freaking water. Daniel, go home. Okay, So, Patricia. I don't think there's a little discomfort here. And if we look at this, we've done a lot of tests. Well, no, we haven't. We've got an IV, debridement, burn management. All of this causes discomfort. The biopsy, the blood draw. How have we only got half a star with discomfort? We've done well here. And emergency care. Jeez. I don't think there's anything that I can... Oh, she doesn't have a headache though. Just say you have a headache, Patricia. Just say you have a headache. And I can give you painkillers. And then you'd be 5 stars. Can't do it. Can't do it though. Can't do it. She's going to be 4.5 stars. There's nothing I can do. Barbara. I wish the game didn't restrict me. I wish I could just give her the painkillers. Do you know what I mean? Why can't I just give her the painkillers? Let me make the medical choices. And then, you know, bring in the malpractice stuff later. Okay. So here, let's start with the physical. We've got vomiting. Let's do abdominal palpitations. We've got fever. Take a temperature. Loss of appetite. Let's go with these things. Go with that. Okay. William Lewis. Carpal tunnel syndrome. So an elbow pad. Do they have to be? I think they have to be hospitalised, or just on the right department. They need to be on the right department. Send them to the right department. Does say office. Does that mean this off? Do I have to hospitalise them? Is what I'm trying to say. They've got elbow pain. I know. Okay, have some painkillers. There you go. Okay. Oh, people are coming in thick and fast over here. Look, we've got 2 with cross. She is actively bleeding. Pause. She is actively bleeding right now. Go to trauma. Can we do emergency care? Can we close this wound? Can we give her some anti-hemorrhagics? She's bleeding all over my floor. This woman has a problem with her heart. Quick, go to trauma and can you do a physical and monitor her heart, please? It won't let me do the heart monitoring just yet. Okay, infectious diseases. We're on emergency, not the best. We've done a few bits and bobs though, haven't we? So the PCR is the test. Let's do a differential. It probably isn't going to do anything for what I'm looking at. But they do super fast differential because this thing I've got on the wall here, it goes faster than the stand one. Chronic fatigue, rest is what you need. Recommendations, I'm going to tell you to get some rest. You've got pains, take some painkillers. We will do the physical, but otherwise you're good, I think, to go home. Patient got diagnosed incorrectly. Oh, really? I diagnosed that one wrong. I did do it wrong. So maybe they sent him to isolation because my normal regular ward on this department is full, and it didn't mean that he had the spreading one at all. Well, tis fixed now. Tis fixed now. We do have a bit of discomfort over here. We've got abdominal pain, fever. Let's deal with the fever. Because we've only got like half a star of discomfort here. It's not too bad. It's not too bad. A lab procedure. Cool. We've got a lot of discomfort here, and it's unknown. Does she have... She's had that, and that would have caused discomfort. So we've got the stool analysis going. Guess we'll just wait for that. We'll wait for that. See what we can do. Oh, the differential got us down to 2. Okay. Let's do the serologic. Let's do the serologic. Do the serologic. We're going to... What's the treatment for these two? They are different. Okay, so for the fever and pain, do that just to improve her discomfort a little bit. Okay. Oh, seasickness. You get seasickness, Chrissy. Did the travel medicines help with that? Do they help? I don't really get seasick. And I can travel backwards on the train. I know some people can't do that, right? You know? Okay. I think this lady's fine. Good. So I was reading chat. Casey. Looks all good. 5-star comfort. No, got the diagnosis, got the treatment. Excellent, not on code blue. Always nice. Long wait for bed. Oh. Okay, let's have a look here. Now, I can't take her off of that ward. I'm going to need to get her onto... Can I... If I hit isolation now, I don't think it'll send her to isolation, will it? I think I have to do isolation, send her to a different department. Right? So if we send her to internal medicine... we might be able to circumvent that issue. Because I don't think she's going to crash. She's got all of her IV and everything. We checked her temperature, so I don't think she's going to crash with her tuberculosis. I think she's okay. Right. He's got quite a bit of discomfort. So we're going to give him those painkillers to try and bring those stars back up, but it's not going to get him to 5 stars at all. He had the ECG. I don't think I can do the auditor on this department. I can't. The eardrops. What discomfort have we got up here? Oh, look at all this chest pain. So look, the CSF sampling, the IV, and the EMS. So his treatments and the tests are what has caused the majority of his discomfort. Now, the tranquilizers give us a positive. So I am going to trank this guy. To try and get him to 5 stars. So we got the painkillers, we got to 4 stars. See whether the tranquilizers might get me to 5, we'll see. Jessica is all good. Go home. Excellent. Beautiful. It's beautiful. It's freaking beautiful. It's beautiful. Right. Let's do a physical and an evaluation. Good. Good. This is the Aftermath series, RTC. This is the Aftermath. We are now into the 24 hours following the nightmare 24 hours. And we are in the Aftermath series. This is it. We've started. We're past midnight. It has begun. We're only at the beginning of it, though. It has only just started. Right, so we don't need to do all these tests anymore. We've got away with that. We don't need to do them anymore. Cancel his tests, send him away. Casey, you have this, right? I'll give you those. Are you hospitalised? You are. Wow, excessive. Had to happen though. Had to happen. Yeah. Oh look, they're all coming for some lunch.
I do Project Hospital patients need potty training? I would imagine they all had that when they were ickle. Well, I hope. We've got catheters here, it's fine. It doesn't matter. I think she needs to be hospitalised for this, doesn't she? Yeah, into isolation. Or does she? I think so. No, I don't think she does. Yes, no, yes. Okay, Susan, it's going to have to tell me. General surgery. So we've done a bunch of tests. We still don't know. We're trying to avoid lab work, but it looks like it might have to happen. Or we could do the CT. We could totally do a CT. Yes, we could. You're having a CT. You're having 2 CTs. You're having 2 different types of CTs. No, you're not. You're having 1 type of CT. Off your pop. Peter? What's the time? Peter. It should be better now. No, you're all good, Peter. You are all good. Excellent. 5-star comfort and everything. Brilliant. Brilliant. They rack up faster now that we're on the other side of this, the first 24 hours. We're on to the second 24 hours. You know. How about you introduce yourself, since people introduce themselves? I introduce myself at the beginning of every stream. I do. I'm Blarla. And we know you, RTC. You've been here before. You hang out. You've hung out a few times. We know who you are. And presumably you know who I am, because this is not your first rodeo at a Blarla stream. What have we got here? Let's see. I think this guy's fine now, because we did the ECG and we've taken his temperature. He's fine. He's fine. Let's not worry about him. This guy is over the worst of it, but we really need to get them the anticoagulant. So let's get them off to cardio. Get them that. Probably. Oh, let's also help the breathing. Chicken pox, antivirals, right? Antivirals. And we've got quite a bit of discomfort. There's itching and fever, vomiting. Well, let's stop the vomiting. Nobody likes that. And deal with the fever. There we go. That's probably more than enough to deal with it. Okay. Trisha had snake bite. Ooh-ha-ha. She's fine. We'll leave it like that. Leave it like that. Yeah. Getting poked too much, time to trank him. Exactly. He was in pain. Oh, I sent them on a lower limb x-ray. Oh. They had the wrong x-ray. It was starting to get proper sketchy, wasn't it? Right, do a physical and then do a differential. No. Mistakes start to happen, you see, because even I've seen so many patients now, mistakes start to happen. Right. Excellent. We are going to do a physical. Was that steroid cream? Steroid cream. Excellent. And then we're probably done here. Good. Confusion. I'm not going to trank her. She is 5-star comfort. She's fine. Leave her alone. Just leave the poor woman alone. Right, Mary. Ooh, we can get you this. And with it, I'm going to... That's probably... You probably need an NSAID for that. Oh, the sampling. It's the test you didn't like. Take painkillers. Take the painkillers. It'll deal with the headache and where we stabbed you with needles. Okay.
Chronic fatigue. We need to get you to a better place. Actually, you're fine here. You don't need the antidepressants. You're fine here. Just rest up. You just need a bed. Rest. Stay there, Markle. And rest. You'll be fine. Jane. Low voltage burn. So now, see again, this burn management and the emergency care is going to cause her discomfort. Now, the breathing problems are also causing her discomfort, so we can deal with those. We can neutralise those. I also think we should put the protective dressing on. Now, it causes low discomfort, and you don't technically need to do it, but it seems weird to do burn management and then not put a protective dressing on it. Like, it blows my mind. We'll give her painkillers. Seems like the least we could do. Right? Yeah. So I'm going to do that extra step just because it's weird to not. Send him home. Send him home. Also, she can be sent home as well. While I'm here. That's good. This is fine. Mary's fine. Does she still need to be? Probably not on a code blue. I don't think so. No, she's fine. Lisa Garcia is good. Yeah, she's fine. Leave her alone. Michael Harris. Go home. Thank you. Nice. Nice. What's going on here? So, they are just in pain. Let's sort out all of that pain and hopefully get back to here. Yeah. And the next one, not going to show us. We should be able to get back to 5-star happiness there. Golfer's elbow. So, an ice wrap will also give us some painkillers for that. Actually, will we? Yeah, because she's in pain. But I was thinking, wouldn't she have inflammation? I don't know. We'll give her the painkillers and something for the fever. That should get her back to 5 stars, I would have thought. I would have thought so. Right? I would have thought so. Yeah. This... We're all good here. Excellent. All good there. Fantastic. Fantastic. It was good. It was good. Frank White. I've got an itchy nose, which I'm not happy about. He's good to go home. Is he? Yep. Off he pop. Okay, Lisa Martin goes much faster when we don't have to do all the stupid tests. Right. Well, you've had your protective dressing. I mean, you seem fine. We do have this brachycardia here. Here. We could do the ACE inhibitors, but we don't really need to. She's fine. She will be fine. Abnormal slow breathing. She'll be fine though. Oh, give it to her. Fine. Okay, Jane Lee. Tonsillitis. So a bit of rest for you, but you've got masses of discomfort from all of this. So let's sort out your fever, painkillers, and then the anti-inflammatory. Do we think that would get her to 5 stars? Because the nasal drops, I'm not sure. No, I'm not sure they're going to do anything. Let's do that first. See where we get to with that. I can hear an ice cream truck. You're good. Sarah has asthma. Help her with her breathing, please. I think though she's not going to crash or anything, so we can get her off of trauma. Yeah. Oh. Can we do... I don't think I can do that test on trauma, can I? No. does have to be in internal medicine, so we're going. Okay. And then we can do it. Keep her on code blue, yeah. Lisa. Fine. Good. You're fine. You're fine, Lisa. You're fine. All good. Patricia. You're fine too, right? Are you? Yeah, you've had the microbial. You're fine. We got you. There's no free bed. In regular hospitalization. Can't send her there. Oh, it won't let me. Won't let me change departments. There must be room on there. There must be room on there. Let's just check. Is there room on emergency? There is. Yeah. Okay. So she should be able to go there. Okay, Barbara is fine. Go home. Excellent. It's going faster now, right? It's going faster now. Now that we've stopped all the mucking around. She's comfortable. She's sorted. Go home. Okay. We can do this. We can totally do this. It's gonna happen. It's gonna happen. Let's see here. I think this lady's good to go as well. Fantastic. We've got up to 5-star comfort. Good. Off you go. Oh, getting them out the door so quick now. This is so good. It feels so good. I don't need to do anything with you. I can't make you any more comfortable. I'm sorry. That is the whole thing. Yeah. There is nothing I can do. Just say you have a headache, Brooke, and I'll deal with it. Oh yeah, Kate, we got her. Look, we've managed to do all of these things. That's good. That's good. So let's do a physical, because she could have an infection. So let's get physical on that. Also, should we bandage all of those stitches and stuff that we've done? Rachel. Right, okay. So we've got a blood test. There's lots here, isn't there? Done the blood test. Oh, we did the CTs. Nothing. We're going to have to do lab work. Did we do stool analysis? No. We did the microbial? No. Okay. We've not done the Barham swallow. Let's do the Barham swallow. It's not nice. But it's also not lab work, so it is what it is. It's probably discomfort in it though. Thomas looks fine. I mean, comfort is the only thing that he has. He's starving. He really needs the toilet. He hates everything about the hospital, but he is comfortable, so that's something. He likes the bed, at least. It's pretty. Look. Nice staff, but he's bored. Nice environment. Has a modern bed. It was a rough night. His needs are critical. He's hungry, but he is comfortable. Okay, Jennifer. Okay, that came back negative. What else could we do with the old eyeballs? Oh, we could do that and that. Guess we'll do those. They're not lab work. We'd have to take her to that room, right? That room. Long wait for examination. We've only just asked for those. Frank has never had an interview. Let's do that. Ask him how he feels, will you? While we wait for all of this battery of tests that we've ordered. Rachel. Okay, let's do a physical. Let's listen to her chest. She's got breathing problems. Let's look up her nose. Because apparently she's got nasal congestion. Which probably means we should look at the throat as well, right? Yeah. Do you know what? We'll do neck palpitations along with the oral thing. And let's also take a temperature. Yeah. And for that discomfort, help with the breathing problems. Okay, great. Thanks. Thanks. I'm seeing a red flash up here now.
Who? Why is it now? Is Brooke? What's going on? Give her that stat. Okay. Okay, Margaret. Excellent. You can go home. You can go home. That's what you can do.
If you enjoyed the video, please like and subscribe. Thank you to all my Patreons for their continued support.